Let me share with you my screen, then we start immediately. So are you getting me from the far end? Very clear? Okay, let's start. So today we are going to discuss about malnutrition. So we shall see the criteria for admission and probably management. So before we start, let me share my screen with you. I hope the screen is visible. Are you able to navigate through? Is the screen visible?
Yes, Julius.
Okay, Charity, please, if you can give a try and define what do you understand by malnutrition? Anything you know, kindly?
Okay.
Yes.
Malnutrition can either be overnutrition or undernutrition.
Great. Let's give him a digital term. Good. So malnutrition is can either be overnutrition or undernutrition. So basically today we are majorly concerned about looking into malnutrition, more especially for children aged 6 to 24 months. So as you can see my screen from the far end, this concern is due to rapid growth and development needs. So and majorly undernutrition in this age group can lead to stunting, wasting, underweight, and micronutrient deficiencies. Are you able to see my screen very clearly? Okay, so we move to the next subtopic. It is about the common forms of malnutrition. So under the common forms of malnutrition we have wasting, we have acute malnutrition, we have stunting, underweight, and micronutrient deficiencies. So with that, under wasting, who can tell us what about wasting? What does wasting encompass? One volunteer, please. Yes, Charity.
Okay, wasting. It stands for low weight for height.
Good. That is very correct. Low weight for height. So and naturally it is donated by a set score of less than -2 standard deviation. What about for stunting? Yes, Nancy, you can give a trial.
Okay, I can say standard code is low height for age.
Correct. Low height for age, but more especially for the infants, these kids who are less than 1 year, we say that it's the low length for age because we measurely take the length and not the height for the kids who are less than 1 year. So let's move further. So first criteria under the management of malnutrition is the assessment and the diagnosis. So under the assessment and the diagnosis, we have the tools majorly used. So the first tool, as you can see from the find, is the yes, Mercy. Hello, Mercy.
Yes, Julius.
So from the find, we have the assessment tools. Which tools that can we normally use under malnutrition when we are assessing?
Mark.
Yes.
Yes, Mark.
So we have the MWAC. We do the mid upper arm circumference, measured noted as when it is the less than 11.5 centimeters, we say that it's SAM. Then between 11.5 to 12.5, we say this the moderate acute malnutrition. Then of course we have the weight for height set score, as you can see from the far end of my screen. So I think up to that point it is well understood. Is it so? Okay, great. So we move further. We got the management of severe acute malnutrition. So we have severe acute malnutrition, which is managed in inpatient, and we have the other that is managed outpatient. So we have the first one. The common form is some without medical complications. We do it majorly in the community-based or outpatient care using the RUTF. Then we do of course routine medication for the broad spectrum antibiotics like amoxicillin. We do vitamin A, and actually we can do deworming and supplement with folic acids. Then number 2, we go with the inpatient care. Who can read for us please the inpatient care protocol steps that are followed kindly? Kindly, one member. Who can give a volunteer and give a trial, or just read the steps as highlighted on my screen?
Okay.
Yes.
We have treat hypoglycemia, and then treat hypothermia, treat dehydration, correct electrolyte imbalance, treat infections, then micronutrient deficiencies, start F75.
Very correct. So under the micronutrient deficiencies, when we start feeding with F75, majorly we call it cautious feeding, and this is the stabilization phase. We revive the body organs because already the body is at the reductive adaptation phase. So after that, we have done feeding with F75, we transit to F100, then we reach the stabilization phase. Then after the stabilization, we do rehabilitation, then we do a discharge, or we organize for a discharge. So then thereafter, let's continue to the moderate management of acute malnutrition. Under the moderate, actually it has no more much to do it. We can just use the RUSF or the fortified blended flours, like the corn soy blend, the one which is highlighted CSP plus the corn soy blend. Then we can do monitoring and caregiver education. Thereafter, we move further to the dietary management. Under the dietary management, maybe Nancy, you can take us through what can we do during this management, or while we are on with the management of malnutrition under dietary management. Just highlight the way they are listed in our screen. Yes, Nancy?
Please, I can be able to access your screen.
Yes.
I'm not able to access your screen.
Are you able to see my screen, please?
No?
Okay, maybe it is technical issues. What about the rest team? Are you able to see my screen?
Yes.
Okay.
Yes.
Maybe it is technical issues with our colleague. Maybe Nancy, you can try refreshing.
Okay, fine.
Okay, then you can hand over to one of the